Hello, dear aquarist. Welcome to my case 133. Today about a Tetra Hyphessobrycon margitae, which we received from a breeder, but was showing serious problems. So I'll show you my findings, how the fish look like in the aquarium, and how we can detect or try to find the the disease in the fish by using a dissection method and a microscope. So I share you my screen and we go and look what we find. Well, in general, we could conclude that we could find tubercles in the organs. It was an Hyphessobrycon margitae, and it is most likely Mycobacterium or fish tuberculosis, although only a laboratory can confirm this if you send it to the lab. Here we saw the fish in the aquarium. Some are skinny, getting darker, not perfect color. Here we see one. Here we see one in the middle. Those are the ones who just here at the end. They're usually at the outside of the group, or here at the bottom here. They're more ahead and it's very slender, skinny body. Well, and they die. Few are dying every week, sometimes every day, one dead one. Here we see in detail, see one at the bottom here. Respiration is also poor. But you see the very skinny body and the fish is wasting away. Well, that is the kind of fish you have to pull out and use for examination, because it will tell you, hopefully, when you do your job right, what problems that you see on the fish. And I just had to tell you and to show you the internal organs, which were full with tubercles. Here you see those kind of encapsulated bacterial colonies. The fish organs react by encapsulating, defending itself against the bacterial invasion by making capsules or tubercles. But at the same time, healthy tissue is gone. Here you see it again. Look at that, all those tubercles here. All these tubercles here next to the liver. Look how many tubercles are here, taking away a lot of healthy tissue. So the organ is not functioning anymore. The fish will become weak. Here also inside the liver, all those tubercles. It's pretty well advanced here in the kidney also. This is part of the kidney. So here, what can you do? Well, for those which are very skinny, wasting away, well, they usually will not make it. And then the treatment, you want to try something, it is already too late. The diagnosis is most likely Mycobacterium, fish tuberculosis. And some fish will have a few tubercles, and they can live for many years if you keep them in good condition with good food. That means no mosquito larvae or other foods that can carry bacteria like Mycobacterium. So you have to check your supply, because some of the live and frozen food do bring in Mycobacterium. That's why we recommend feeding granulated food, which is 100% safe. Treatments with antibiotics have shown that it's not so very effective. But still, you can ask your fish doctor. He might have some suggestions. And we have some suggestions in our books, but still difficult to control and treat the bacteria, which here are encapsulated. So it's difficult to get inside those capsules and treatment, because they're encapsulated, protected for any treatment. But you can help the fish which are still alive and eating well with our Dr. BASSLEER BIOFISH FOOD FUCO or the professional treat. That helps in the fish to control their health and maybe live much longer. These fish came from a breeder. So if you have a case like that, inform your supplier, because he can check where the fish came from. Read my books. I explain Mycobacterium in both my books in different languages available. Or you can go to my Patreon, where I have had specific chapters on Mycobacterium that I discuss in my fish disease classes. So thank you for watching and continuing to be an expert aquarist by already watching so many of my videos. Try to stay informed and you will be happier in keeping fish. much longer alive. Thank you.